My name is Mackenzie Gulley, and I'm a senior at Eastland High School. Today I'm going to talk about laser eye surgery. There are many different forms of laser eye surgery, but today I'm going to talk about cataract surgery. There are also different kinds of cataracts. One of them is a subcapsular cataract. Occurs in the back of the lens. People with diabetes or those taking high doses of steroids have greater risk of developing this kind of cataract. Another one is a nuclear cataract. This one forms deep in the central zone of the lens. Nuclear cataracts usually are associated with aging. And lastly, a cortical cataract. This type of cataract occurs in the lens cortex, which is the part of the lens that surrounds the central nucleus. A cataract is a painless cloudy area in the lens of the eye. The lens is enclosed in a lining called the lens capsule. The surgery separates the lens capsule. It gets rid and replaces the lens, which is called a lens implant. This is also called an IOL. When you get cataracts, your eye develops an opacification. This causes loss of transparency, causing loss of vision. Many patients' first symptoms are strong glares from light. A cataract, this is examples, a cataract may make light from the sun or lamp seem too bright or glaring. You may notice when driving at night that the oncoming headlights cause more of a glare than before. Colors may not appear as bright as they once did. The type of cataract you have will affect exactly which symptoms are experienced and how soon they will occur. When a nuclear cataract first develops, it can bring about a temporary improvement, which is a near vision called second sight. Unfortunately, the improved vision is short-lived and will disappear as the cataracts worsen. On the other hand, a subcapsular cataract may not produce any symptoms until it's well developed. The lens inside the eye works much like a camera lens, focusing light into the retina for clear vision. It also adjusts the eye focus, letting us see things clearly both up, close, and far away. The lens is mostly made of water and protein. The protein is arranged in precise ways that keeps the lens clear and lets the light pass through it. But as we age, some of the protein may clump together and start to cloud a small area of the lens. This is a cataract. Over time, it may grow larger and clouds more of the lens, making it harder to see. No one knows for sure why eye lenses change as we age, forming cataracts, but researchers worldwide have identified factors that may cause cataracts or associated with cataract development. Besides advanced aging, cataracts risk factors include diabetes, obesity, smoking, using too much medication, reduced cholesterol, injury of your eye and inflammation, previous eye surgery, hormone replacement therapy, significant alcohol how much alcohol you drink, and family history. Cataract surgery is usually performed by an eye surgeon. This takes place in a hospital, and usually you have amnesia. That way there's little pain or no pain at all for the patient. After the surgery, you need immediate eye care. The surgeon reviews symptoms needing eye protection, activities, and medicines. The eye that was operated on you will need to have a bandage over it the day after. And you will also need to wear a protective shield over your eye while you sleep for a week. You do this because while you're sleeping, you're unconscious and you're not aware of what you're doing. So it's to protect your surgery so you don't have to have surgery again to fix it. This surgery is very successful. For 85 to 92 out of 100 adults, this can also improve vision for babies who have cataracts. People who have surgery for cataracts also usually have improved vision, increased mobility, and relief of going blind. There are risks of having cataract surgery, but less than 5 out of 100 have had complications that could be threatened their sight. Although the risk is low for the surgery, it does involve risk of complete loss of sight. Complications that happen are infection in the eye, swelling and fluid in the center of the nerve layer, bleeding in the front of the eye, swelling, bursting of the capsule, and detachment of the nerve layers at the back of the eye. There are some ways to try to prevent cataracts, and that's wearing sunglasses and wide brim hats or ball caps to block the sunlight. Don't smoke or drink alcohol. And cataracts, you don't always need to have surgery right away when you first get it. You need to have surgery once it's well developed, or it could be dangerous. I got my information from webmd.com, and thank you for listening.